Welcome to Distance is No Obstacle, a medical education podcast aimed at providing bite-sized education and information for people working in rural and remote Australia. Today we chat with Locum Dr. Lin Arias about the services and resources available to locum doctors by Rural Health West. This is the second part of a two-part series.
Look, if you are really happy with what you are presently doing, you probably won't be listening to this podcast because you're happy. You feel fulfilled financially, intellectually, professionally. You may, your family life works well. You're happy. So why would you want to change anything? For me, I love learning. And when I have gotten to the point where things are repetitive, I get tetchy and I get restless. And it really took this information from my friend for me to realize, as she pointed out, that I'd been restless for about 4 years at this particular practice. There wasn't anything wrong with the practice. It just wasn't offering me the steeper learning curve that I realized I was craving. And I've already told you I love to travel. So what's great about doing a locum? Well, Rural Health West will fly you to and fro wherever you need to go, or they will, if you decide you want to take your family in your car, they will defray your travel expenses. You get a free place to live, and I assure you the accommodation will be a minimum of 3-star. You will get a vehicle where you are, and at the vast majority of places, and certainly the places that I work at, you get your weekends off. It is an 8 to 4 or 8 to 5 job with an hour off for lunch. And you have your weekends to go explore. And if you are an ocean person, well, pick a locum by the ocean. If you are wheat fields, you like the farms, you like the dryness, you like the big open skies, well, pick the wheat fields, pick the Gascoyne, pick the Kimberley. And all you need to do is do what you already do really well, and that's general practice. You don't need to upskill. You don't need to learn anything new. You have your fellowship, you're vocationally registered, you have a few years at least under your belt in general practice. Go and do a minimum of a 2-week locum at a group rural general practice, and it may just add more excitement to your life than you could have imagined. You will meet new people. You will work with a team who is so happy to have you. You'd have to be deaf, dumb, and blind to ignore all the information around us that shows how medically short-staffed country Australia is. And not just medically, it's true for a lot of the allied health professionals as well. But certainly for general practice, we are so much in demand, and we have been for a long time. So you walk in the door, I can't say you've achieved sainthood, but you're not far from it, because people are so happy that you're there. They're going to make life easy for you. Yes, you'll have to learn about the new referral processes and, who are the local resources. That's fine. The other GPs will tell you. I can tell you that the reception staff and practice manager, they'll know half the people in town. So they'll say, this is the chiropractor, this is the physio, this is where we refer for this. They'll show you the templates on the computer. I have found most places use best practice. And maybe that's true of most general practices now, but that's certainly useful to be handy with that one. You will learn everything that you need to know. It's really not as daunting as you may imagine. I'm thinking of some of the questions that people asked me at an information night a couple of months ago. People asked about families coming. Absolutely, bring your families. You have your weekend off. You'll have a vehicle. And for 2 weeks, go exploring. Many of the towns have fabulous community resources. And if after 2 weeks you don't like it, let's face it, we have all done rotations that lasted a whole lot longer than 2 weeks that we didn't like, and we lived and we learned. So you may do a rotation, and I have done one locum at a place where I thought, well, that was interesting. However, I don't particularly wish to go back there. The other places I go to, and they are mainly Esperance and Kununurra, I feel a part of the communities there. There are aspects of not only the land and the seasons, and I'm very much an outdoors person. There are aspects of the community there that I like. I like kind of the frontier mentality. And there are so many good people doing good work. It's such a pleasure to meet them, to be a part of their team, and for them to know that they actually are connected to the outside world and that people in Perth actually do think about what's going on in their town. Now, there are people who locum, who pile up their family in a caravan and just go from place to place for a couple of weeks and go traveling and earn some money and travel on, and that's fabulous. For me, being part of a community actually matters, which is why I go back to the same places. And I've been doing this now for 3 years. So I pick the seasons I want to go there. So let's get on to being a locum. So you've contacted Rural Health West, and you can look at their website and see where all these great places are. And you go, well, I'm not a hot weather person, so I'm not going up to Broome in November. I don't blame you. I wouldn't go to Broome in November, or I wouldn't go to Kununurra in November. I definitely only go there during the dry. Or maybe you go, I really love wildflowers, so I'd like to go to the wheat belt for a couple of weeks in September. Fabulous. Go and see what's on the website there. So they'll have information about the practice, what level of kind of skills they need, because obviously if you're the only GP, they need more emergency level skills, and what's expected of you, whether it's expected that you will cover hospital-based patients, whether it's expected that you're going to supervise registrars or medical students, or whether you're going to do on-call or make nursing home visits or work on weekends. The places that I go to, I don't do those things. I have occasionally covered people for making nursing home visits, and that's fine. That's in practice time. That is not in addition to the time you spend in the practice. So you can pretty much go, well, I'm happy to go here. However, I don't want to do, say, the hospital-based work. And Rural Health West will then get back to the practice and say, we have someone who's interested. Would you be willing to take them on if they don't wish to take on this additional responsibility? So the Rural Health West is very happy to then, and this is what they do, to negotiate between you and the practice. On a financial side, most practices offer a per diem. So, and I will make up these numbers, but generally anywhere between $1,200 and $1,600 a day, depending on the level of responsibility you're going to have, plus GST. Some places will offer you a percentage of your billings. My advice to you is, if you're keen on the percentage of your billings, then also have the per diem as a backup. So $1,200 a day plus GST, or 65 to 70% of your billings, whichever is greater. The reason I say that is because we've all gotten burnt in situations where we've thought, 65% sounds great. Remember, in a locum, you are not in control of your billings. So while a practice may have charged $95 for a 23 level consultation, that doesn't mean they always get it. And that doesn't mean that those privately paying patients are happy to see you as a locum. So you're not in control of the billing. I strongly recommend you at least have a per diem as a backup. And then also you know exactly how much money you're going to be making from your time there. With time, you can certainly negotiate other things at a practice that knows you well. There was one practice that seemed to think that I was going to get paid as a percentage of my receipts, and we set them with the help of Rural Health West kindly and consistently that no, actually the contract is on the basis of billings, not receipts. Because as we all know, it can take many months for those workers' comp consultations to be paid for. So per diem, if you wish, plus a percentage, or a percentage of your earnings, and you'll know exactly then what you'll be getting from a practice, and you'll know what your responsibilities are. And it's all quite well laid out in a very simple contract. You do not need a lawyer to review the contract from the practice via Rural Health West. It's really very simply laid out. So what else is fun about it? Well, you're going to visit places you wouldn't have thought to visit. You're going to learn a bit about your country and your countrymen and women that you didn't know before. Because no matter how well read or how learned we are living in metropolitan Perth, we really don't know what it's like for people living in country areas. We don't really know the food shortages that take place, the unemployment, some of the youth problems, the aging populations. We don't know how incredibly skilled these people are who live and work on farms, on trades, and how incredibly warm and friendly and welcoming. You will hear some of the greatest stories you will have ever heard, and you'll go, I just can't believe that. But okay, he's got the scars to show it. Some of the stuff you'll hear is really wild, and people say it with a grin. They may not have a lot of teeth in it, but and they're the nicest people, and they so appreciate that you are there. One of the things I love is in the country, I feel far more respected for the years of training and experience that I have. I'm a doctor, and people really respect that. They haven't come in having Dr. Googled and are coming in to actually challenge me. They so respect my skills and that I am there to do the best I can for them. And I just love that. I absolutely just love that. They see they have their expertise, and whether it's fixing a fence or fixing a car or driving a truck, and I have my expertise, and they respect that. I can't emphasize how refreshing that is, because in a lot of my experience in metropolitan and suburban practice, you're working with people whose educational level is the level of mine, and they are quite happy to kind of play the expert. You won't get that in the country. People are so grateful that you're there, because you're going to see people who've been waiting 2 and 3 months to get an appointment for you. That's pretty specky. Now, that can also feel quite overwhelming. So I can also hear people going, Jiminy Crickets. People come in probably with about 15 things they want me to manage because they've been saving them up. Well, 15 is a bit of an exaggeration. 5 is not. And so that's where your skills in managing a consultation come into play, with ensuring that people have a realistic expectation of what you can comprehensively and effectively help them with, and that while you're there, you can see them back. That's about good general practice. And sometimes we can't manage all of those things. Okay. That's just about good general practice. How do we manage patients' expectations? We tend to use a fair bit of telehealth in the country, and that's great. So when someone has an hour and a half drive to come see you, assuming they have phone reception, sometimes it's better to manage things over the phone. And if you say, look, I really need to see you, they'll say, okay, doc, I'll get someone to drive me in. Can you see me in a couple of hours? There's a lot of mutual respect that goes on there. If you are easily unsettled by challenges, then pick something quite easy. So like I said, no more than 2 weeks, and just see how that works for you. I've already explained, I get intellectually restless. I get physically restless too. I like traveling. I love hearing other people's stories. Sometimes we can feel overwhelmed, and that's when you know it's enough. I mentioned earlier I'd been up to Kununurra, and I was there for 3 months, which is a very long stint. And because I know me, I only generally go for a month at a time, because after a full month of full-time general practice, hit the ground running, 125 patients a week, I am really burnt out, even though I have my weekends and my evenings free. So I engineered with this contract that I'd work for 3 weeks, have a week off, 3 weeks, have a week off, and do it that way. And even at the end of that, I was really, really wrung out. So I've learned next time, no matter how much I enjoy that, I won't do that for that length of time. The reason I did is they were so short-staffed. And they were. There were days when, even though this was a group practice, I was the only doctor on. So it's important to learn what our limits are. And if you're feeling like, I'm not really to kind of take on a new community and a new challenge like that, that's fine. Just keep it in the back of your mind, because at some point, I think you're going to get a little bored with suburban general practice, and you may just want to stretch your wings, use a different metaphor, take the road less traveled by, and you may just find it's the most exciting thing you've done to rekindle your love of medicine for a long time.